Virginia based. Virginia is actually the longest place that I've lived because I did come from a military family, so I did move around quite a bit when I was younger, but I have landed here in Virginia and
ASU, so
I don't know what happened.
No, I'm sorry. I just started the YouTube live too, so that sound echoed, but I muted it on the. Anyways, continue. I'm sorry.
Okay, great. Well, that's really about it. So if you want to hop into my slideshow, that'd be perfect.
All right, guys. She has created a slideshow for you, so I will pull that up right now. All righty, here we go. Can everyone see it?
Let me see.
All right.
Perfect.
I can see it.
That's awesome. And while we're waiting, those, just so I can get to know you guys, give me a thumbs up in the chat box if you are a college student.
thumbs up.
Yeah, give me a thumbs up just so I can see how to be. Good. Awesome.
All right.
Wow. Okay. And then how many of us are high schoolers? Gotcha. Cool, cool, cool. Just so I know who I'm working with.
All right.
Cool. All right. So this is my presentation on just how I got to where I am right now in my nursing career, working in the PICU. So this is just my basic overview. I am actually celebrating 5 years as a nurse this month. I took my NCLEX July 17th, 2015. So I can't believe it's been 5 years. It feels like it was just yesterday that I was studying for that test. I spent 2.5 years actually in the operating room before I came to PICU, and now I am about 2.5 years into my job as a PICU nurse. And when I am not in the hospital, I do enjoy a lot of activities outside of work. But something that really just sets my heart on fire is working with my high school field hockey girls. I do coach a high school team. And unfortunately, they are also experiencing the wrath of COVID-19, and we are having a lot of practice issues and being able to come back to their school semester. So for now, while I'm not going to the gym, I am working out a lot at home with my husband and spending some good quality time with my fur babies, one of which is, oh my goodness, right here. So this is Mitty. But yeah, so that's, that's kind of a brief synopsis on me.
So while we're here, do you mind telling us like your background, like what led you to want to become an RN? Like how did you get here?
Right. So that kind of delves a lot into where I started in high school. And if you actually want to click to the next slide, I can kind of go through that a little bit as we talk. So for those that don't know what the PICU is, I care for critically ill children, and that's day 0 to 18, not like the NICU. I think where you get commonly confused with the NICU, who takes care of preemies and neonatal patient populations all the way up to infancy. And so I deal with an average of like 1 to 3-year-olds for the most part. Those are common on the slide, common admissions that we see and my patient ratio as well that I'm taking care of. But what led me to this area and becoming a nurse really started when I was in high school. I took a EMT course through my high school, and that just opened the door for me to work with transporting and packaging our patients and getting them to the hospital to receive the care that they needed. And that introduced me to the ED and nurses and doctors that were working there. And it just right then and there really sparked my interest in pursuing a career in the healthcare industry. As far as nursing, that was really a big conversation between my mom and I. My parents, in particular, my dad was based out of the Air Force, and my mom was a stay-at-home mom. But I think that if she had chosen a career path and had not been a stay-at-home mom, she would have been a nurse. She totally has a nurse's spirit. And she was the one who truly encouraged me to take this path. And so that's kind of how I started, or even looked into applying into nursing.
Wow, that's great.
Yeah.
So going off of that, as someone who's an undergrad, how would you suggest a student to get started?
So to get started, in terms of getting started in nursing, I think it's really important that, especially in times like now, where we have a lot of hospital restrictions as to what personnel can be in there right now, and even visitor restrictions, just to limit the number of people going in and out of the hospital setting. It has made things more challenging, especially for our high school students, because my biggest advice for you guys is to shadow and follow people in their jobs and see and physically see what they're doing. Because I think it paints a really vivid picture as to what life is like as a provider, whether it's a doctor, nurse, or like respiratory therapist or anything like that. However, there are baseline skills. I like to call them, they are our functional life skills. And it's how we interact with each other that I think really sets up your baseline for just being able to communicate with other people as you navigate your career. So just touching base on things that I did in high school that kind of set me up. I mentioned that I got certified as an EMTB through my high school program. I worked in summer sports camps a lot of the time. I was very highly involved with field hockey, and I played not only on my high school team, but I played for a travel league. And then in giving back to like those teams would host summer camps and just really get to interact with kids, which sparked, my love for working with them. I was also a hostess. I got my first job when I was in high school. And I think that taught me a lot about just customer service in general. Because, while we're here in the medical field, trying to, save people's lives or improve their quality of living, we're also providing them a service. And so I think it's important to have good manners around people when especially when you're taking care of them and really trying to cater to what their needs are. And then junior year is probably when I started looking into college programs, just because I didn't know what the application process would look like. But yeah, so after my junior year, senior year, I rolled that's when I was going to look at colleges and really find out, where was my perfect fit. And I ended up applying to Lynchburg College, which is in like South Central Virginia. It's just south of Charlottesville. So that program itself, it was a private university. Well, now they're a university, but private institution. And talking a little bit towards that in the application process, everything was online, and I did go for like a visitor's day, which was fun because you got to be on campus. But what really drew me to this particular college was that, my mom, I told her in my heart of hearts that I really wanted to play for the U.S. women's field hockey team. And she said that I couldn't do that and that I really needed to choose a career path that would lead to a job afterwards. Nursing, it just so happened that they had a great nursing program and they had an awesome field hockey program as well. So in that, I was able to not only, go and get my nursing education, but I was able to participate in things that I really enjoyed, and I played all 4 years there. But just to speak a little bit more on the Bachelor's of Science for this unit, in particular college, the freshman year, when I first came to the college, you actually declared your major, um, and I declared nursing, but that didn't mean that I was actually in the program. So freshman year for me, I had to take prerequisite courses, which are listed. It was chemistry and chemistry lab, nutrition, statistics, and then there was a fundamentals of nursing, which was also listed kind of like as a psychology course. But that really, I think, just set the stage for me to understand like what I was really getting into at the time. So along with that, the prerequisites, you had to have a certain GPA. Obviously, honestly, a 3.5 or better was what really made you marketable and a good applicant to be accepted into the program. We also had to take a TEAS test. So it's just like a baseline education testing that was hosted through a company called ATI. And then we actually used ATI the entire rest of the time that we were there. And they had particular books for each course that we took on nursing classes. Like there was a pediatric one, a med surge, and so on. And so we would take just baseline tests at the end of each semester for the courses that we had taken. And by the end of my program, my senior year, ATI also had our NCLEX prep course, which was required that we sit after the end of the school year for, I think it was 3 days. And we would just study and prep and go over what requirements were on the NCLEX and what kind of questions we would be running into. So my extracurriculars, things that just kind of pulled me away from nursing, other than doing shared governance, I was president of our nursing organization my senior year and would attend like the weekly meetings that we would have. But obviously I did sports. Field hockey was my main one. I played all 4 years, but I also ran track for 2 before realizing it was a little bit too much to juggle. And it was a lot of wear and tear on my body at that point. My senior year actually ended with a season ender break to my foot. So I ended my season halfway through, and I also couldn't stand that happened. So our tennis team was kind of falling apart in the springtime. And to keep that program afloat, I actually played 1 season of tennis at our university. I was really involved in Greek life. That I didn't start my freshman year. I actually came into it a little bit after, when I felt like I just needed to meet more people on campus that weren't just in sports. And it was honestly one of my favorite experiences, and taught me just a lot about like communications and how to interact with different organizations on campus. And while all this is going on, I also did have a campus job that helped alleviate some of the burden associated with being away at college, so that, I was lucky enough that my parents were able to support me. But the campus job definitely took away and gave me a little paycheck here and there to just take care of things that I needed. And the only other thing that I could really highlight on is that I did do a study abroad. I lived for 6 weeks down in Mexico, and that was testing out of my advanced level Spanish class. So I did have the opportunity to study abroad my summer before my senior year, and that was just one of the greatest experiences. I lived with a host mom and and that family for 6 weeks, and it was just me from the college for about half of that until one of the other students from my program came down. Her study abroad was just a little bit off from mine. So a little scary to start, but overall an amazing experience. But I think
So going along with all your extracurriculars and stuff, I do see a lot of questions about shadowing. So how did you get a shadowing position? Like, how do you go about talking to nurses or other health professionals? Like, how do you suggest we try to get a spot shadowing?
So that right now obviously is difficult because they are limiting, the number of people, extra people coming into like the hospital setting or wherever you want to shadow. But what I highly recommend is if there is a particular hospital that you are interested in or that offers a position that you're interested in, I would go to like their human resources and reach out to like whatever contact information is on there. You can not go wrong just reaching out and being like, hey, I'm a student, I'm really interested in this. Is there an opportunity for shadowing, or could you put me in contact with X, Y, and Z? These people would be great, and I think that they would speak to like the experiences that I want to have. So just finding the contact people is a little bit challenging. For me, it was a lot of networking with family members that were already nurses. So for me, I had a couple friends and their moms were nurses. And I reached out to them and was like, hey, how could I follow you around at work? And it would be them organizing it through their manager, having me come in and follow them around for the day.
Okay. So along with, I see your whole extracurriculars, the shadowing, like the sports and studying abroad. Along with that, what type of jobs would you recommend? Like if I want to become a CRNA someday, what kind of jobs like CNA, EMT, stuff like that, what do you suggest would be best for me?
Right. I would say that literally any experience is a great experience because it gets you out there, gets you working with a team, and really shaping your mindset on how to be a great provider. So for me, obviously that was doing my EMTB certification, and I rode with a local ambulance team throughout like my junior and senior year. And that gave me great experience. And that was really awesome to just have on my resume and be like, hey, I was like, I'm definitely interested in the healthcare system, and this is what I did to show that. And other jobs, like I touched on earlier, you could literally be a hostess and it's fine because that's honestly your step in your journey. There's when you're younger or you don't have a lot of experience, it's hard to get into certain job areas. And if you want to do CNA, which I do recommend, especially if you're considering nursing, because that gets you right there at the bedside and interacting with patients and nursing staff and other healthcare providers. That in itself, though, does take a certification and other training, and it really depends on your lifestyle and if you can accommodate that. So if it's not in the budget for you to do that and, get your CNA certification, or you can't pay for like the EMTB certification or anything like that, don't worry about it. Just get job experience, work in community service, or volunteer, just things that put you out there, and get you lived experience and interaction with other people, which right now I understand is really hard. So.
Yeah, with the virus and everything, it's really hard to get out there. And just like tying it all together before we move on to testing and how to study for that, how do you get letters of recommendation? How do you tie everything together into your application? Any tips for personal statements, essays, and just like how to overall like be a better applicant for nursing school?
Right. So that's just touching base on that, there really is a need for you as an individual to be yourself, and put out like what you have done. I know that a lot of people just want to follow a template and be like, oh, I checked this box, this box, this box. But what applications are like geared towards that they want to see you and hear about your lived experiences. So I think just taking your time to really sit down and ask yourself, what have I done? What are my aspirations? What are my intentions? And just reframing your mindset that way will help you write just better essays in general for admissions. I know that, especially with applying to college, you do have your SAT scores and things like that. And obviously you want to score high on those. Have a marketable GPA. 3.5 is really like the ticket. And like if schools see that, they're like, oh, great. Just not like Ivy League schools, but
Yeah.
just in general, making yourself a good, showing that you are a good student is really, really huge.
Okay. So we are going to move on to testing now, just how to study for the TEAS test and the NCLEX, just study tips you might have for us, and how to excel on those.
And then here comes my favorite Oscar Wilde quote: "You can never be too overdressed or too overeducated." Any learning opportunity is just gonna be paramount for giving you, again, that lived experience, and it's something that you just can't take it away. I think that it's really important as a student to just figure out what kind of learner you are, because whether you're visual or auditory, you finding out what works for you is very important, and it will make your study habits more cohesive, and hopefully improve your knowledge base a lot quicker. So that is like my number one: figure out what kind of learner you are and just stick to it. For me, finding a study group at school was very important. I did have one other friend in the program that I was very close with, and we made it a habit to really study together, because things that I would pick up on in class versus like her notes, we were able to compare things, and then just talk through simulations or scenarios, and then even reach out to like professors and things like that. For not every school, I actually talked to one of my other coworkers last night, and I told him, he looked over this presentation, I told him about having to take the TEAS test, and he said, I didn't have to take that. So don't freak out, because you might not, your program, the nursing program that you apply to might actually not even require that. That was just one for my university. So they actually provided the study materials for that, and it was just a lot of practice questions and a lot of general stuff. As far as Kaplan NCLEX prep, like I said, ATI was provided to us, and they did do an NCLEX prep. I really battled against ATI when I was at Lynchburg. It didn't sit right with me. And so I actually purchased the Kaplan NCLEX prep, and I could not recommend it more. It had slideshows. It had somebody speaking and teaching on topics, and then just the format of questions and going over, for those that like might not know, the NCLEX is actually based off of four tiers of questions. So you have tier 1, 2, 3, and 4. The tier 3 and 4 questions are what send your competency line over that. So it's very, very important that you become comfortable with answering tier 3 and 4 questions, not just like baseline ones, like, what is the femur? These are made to be critical thinking questions that really make you think a little bit outside the box, and give you that pass rate that you need. So for me, although it really made me anxious during my NCLEX, when I was answering select all that apply questions, I knew that I was answering tier 3 and 4 questions. So just understanding the nature of the test and really highlighting and studying to that is very important. So just I would be very diligent in looking into preps that are going to work for you, and also tying that back into what kind of learner are you. Because obviously it's, what works for one person doesn't work for another when it comes to studying. I also joined the AACN. It's the American Association for Critical Care Nurses and the American Nurses Association. And they actually put out content as well, which is very helpful. And they have student rate memberships. So that helped me, network with other people and talk with my preceptors, my practicum year. I was able to talk to them about the test and just get mentorship guidance from them.
All right, so moving on to a little Q&A, because I see a lot of questions in here, and there's some really good questions in here. So let's just go through this. Oh, a good one is, how do you study different from undergrad versus nursing school? So like before you start nursing school versus after.
So, so undergraduate study for me, like the freshman year before actually like applying and getting into the nursing program, I actually had a freshman year like residency through the college, and it was formulated to make sure that freshman students, were really getting the hang of being a college student, showing up for your classes, making sure that your calendar was laid out with your assignments. So freshman year, I definitely felt very, very easy and very similar to just my high school expectations. I would just study, depending on when I had a test, I would normally study like 3 to 5 days before and just do little snippets and get together with groups. I felt like my study sessions had to be, on point, because I had a lot of other things going on with balancing a campus job and playing sports that also required me to travel to like as far as Pennsylvania some weekends. So my time, I was very regimented in when I was studying and when I was not. So I think it just depends for like that particular person, what your habits are, and again, what kind of learner you are.
Another big one is, how would you recommend finding mentorship opportunities and gaining experience right now during COVID? I actually saw that one quite a bit in this.
Yeah, so I would just get on the Google. There are plenty of nurse mentors out there. There is actually an organization, I'll have to look it up real quick, but it is for nurse mentorship. And I'll find the link and send it to you guys later. But I think also social media has just been a great tool. Because, even with, my Instagram platform or my TikTok, students have reached out to me on how I got where I am. And so that's even what provided me this opportunity to speak to you guys. So I think you can find mentorship all over the place. And if you just have very particular questions, reaching out to, people on social media and just being like, hey, like, how did you get there? Or, do you have like 10 or 15 minutes to maybe like FaceTime with me? Especially in like the pandemic time, because it's so hard to meet face to face with people. I think that like this is a great opportunity for us to pivot what we would normally do in shadowing and mentorship, and just reach out, be a little bit more socially connected and reach out by social media platforms. And I just, from the people who have reached out to me, I realized that there really is a need for mentorship, especially in nursing. So I myself am working on a mentorship program to help student nurses. But I think just reaching out and finding those people and looking and being like, that's where I want to be in 5 years. That's what I want to do, really reach out and find those people.
Mm-hmm. So some questions are about majors. Is there any specific major that you would recommend over another in undergrad?
So undergrad, and this is actually helpful because there are associate degree nurses. The 2020 initiative was to have 80% of nurses be bachelor's prepared. So when you talk about undergrad, that is your BSN. It's a 4-year degree. So when you apply to a college for a bachelor's of science in nursing, like that is your degree path, and your course journey is really based off of that with your advisor. So there's really like no other thing to be taking. And then the other thing to consider, I guess, is that if you've already gone for a bachelor's in something or another, say it was communications, and then you realize, oh, like maybe this isn't for me, and maybe I do want to go to nursing school. There are accelerated programs. So those are, people who they're already bachelor's prepared in whatever their undergrad study was, and now they're pivoting into the nursing role. So, the experience, it doesn't really matter what it was, because you can always pivot into nursing. It just depends on what school you're going to. And again, then you want to fall back on, what skill set do I have now that makes me marketable to be like in this nursing program and make the transition. So marketing yourself in that way is very important.
So let's just do one last one before we move on to your life now and, post undergrad. But what made you pick nursing over PA, MD, DO out of all the other options? Why nursing? And any advice for students who are considering nursing or who are starting nursing?
Right. So why nursing? For me, nursing, I knew it meant being closer to my patients. Whereas a medical doctor, like that does not to say that there aren't doctors out there that are close in contact with their patients and working directly with them. But the mindset is very different. While I'm caring for, the person as a whole, like a doctor is focused on the diagnosis that they're coming in with and their treatment path and how to adjust that based off of what I'm telling them that I'm seeing in my assessment. So a great example is like, I have a kid that comes in, he just got his appendix out, and my doctor prescribes, PO Tylenol in a pill form. But I know my patient, is not ready to take pills, or because he's at the age he's at, he only likes the grape flavored Tylenol. That's that nursing lived experience right there, is that you're connecting on a social level with your patient to optimize their care. And it's very, very focused, rapid assessments, and good communications with your physicians so that they can tailor their treatment plan and optimize their overall hospital stay. So I just knew, I was like, I'm a caregiver at heart. I'm like an Enneagram 3 or something like that. And I just, I want to do the most for my patients and really connect with them. And I felt like nursing was that option. I also felt that nursing allowed me to be a little bit more fluid in my career path. So maybe if one avenue didn't work out or I didn't like it, you can always change. You can be very marketable. And I found that in my own experience. When I applied to jobs after college, my institution required that clinician ones actually apply to 2 jobs. And my other interview actually dropped 2 weeks before. It was on like a heme-oncology unit. And so the only other job that was open was the operating room. And of course I was like, I don't want to be an operating room nurse. I don't know anything about it. I had done my practicum in the post anesthesia care unit. So it's like, I had never gone into the operating room. But I knew I wanted to work at this hospital. So I took that opportunity and I was just like, it's experience, it's fine. And I'm going to learn regardless. And then my foot is in the door. And you know, you can always do an in-house transfer. And so that's what happened. I really fell in love with pediatrics, and then I pivoted. So any experience is good experience. I just think framing your mind as to what your 5-year plan is and what you want your life to look like is something that is a real driver in what you choose to do. So if you know want to be if you want to be the big brains making the decisions for patients and diagnosing them, you know, go for that. Go be a doctor, go be a physician's assistant and work, you know, just underneath them and help them care for their patients. But you know, just nursing in general, I know that I still have a ladder that I can climb. I can still go. And if you know, I want to make maybe a little bit more money and I want a little bit more responsibility, I can go and get my master's. I could be a nurse practitioner. And then I have script ability, so I can actually write prescriptions. I can help diagnose. I can form treatment plans. So you know, the possibilities are kind of endless right there. And then if I want to take a little back seat after that, I can maybe teach. So I don't know. It's just as nursing is something that really just made sense. It made sense for me, and it's been an easy decision.
That's wonderful. That's awesome, truly, to have found your calling.
Yeah.
So moving on to graduate studies, because I do see a lot of questions regarding that, and in time, people, we will get to everything you guys are asking. But starting off with post grad, like, could you talk about your first position, obviously, and like how you switched specialties and along those lines?
Yeah. Yeah. So I started by my junior year, by the end of my junior year, I was in college. I was already looking into, you know, where I wanted to work, like geographical location where I wanted to work, what positions I was really interested in, what patient populations I was interested in. And I knew that the hospital that I applied to first, that I was like, I want to end up here. You know, I want to live here. I want to start my career here. I was very astute and found out, you know, when was their new grad hire period? What were their prerequisites? And over that summer period is when I really dug deep. I got my resume together. I got recommendations together. And you know, I tried to reach out for shadow opportunities. That was a little bit difficult to do, but also a lot of hospitals have career days. So I highly recommend going to those. We were required to be a part of the ANA when we were in nursing school, so American Nurses Association, that they also had conventions. So that helped market, like, you know, just network with people and get their perspective on where they worked. So that was, I think, was really important. So I actually applied in November to the jobs, the two, the operating room and then a heme oncology unit. Those were the two that I applied to first. As far as like heme oncology, I thought it was really cool and interesting. And I thought that it would be very specific patient population, and then operating room. It was the only other position open. So I was like, oh yeah, sure, I'll do that. Just because they required it. So I was kind of freaking out when that first job filled all their positions and dropped my interview. But again, you know, just keeping that frame of mind and knowing, you know, this is where I want to go. And this is the hospital that I want to work in afterwards. I was not willing to budge from that. And so I just thought, you know, any experience is good experience. So I accepted a job in the operating room. I specialized in pediatric surgery. I actually had a very long 6-month orientation. So I did every surgery, like cardio, thoracic, neuro, ENT, general surgery, pediatrics, transplants, orthopedics, you name it, like every single patient population. And while I don't recommend new nurses starting in the operating room, this was an experience that totally shaped my entire life, because I don't think that I would have had the confidence or the courage to pursue pediatrics if I hadn't done it. You get to work hand in hand with your physicians. and surgeons and anesthesiologists. You get to learn so much, and also the hands-on skill with logistics of running an operating room. It does translate to even being a floor nurse and having to do like a bedside procedure, and you want your room set up a certain way and safety measures in place. I think it really framed my mindset in that sense. So I spent 2.5 years there, and had specialized particularly to pediatric general surgery. So I did anything kind of from here down, including the general portion was a lot of open abdomen cases, but I would cross train to orthopedics. I did genitourinary surgeries, bowel surgeries, tonsil removals. We had neuro and spine cases, and then something that is what triggered my desire to transition to a new role was doing ECMO, and that stands for extracorporeal membrane oxygenation. And that is when either a person's heart is failing and it can't do its job, or their lungs are failing, or both. So we put them on a small bypass machine to accommodate for them. I scrubbed in and did a lot of those procedures, emergency procedures with my surgeons. I just loved it. I wanted to know more about it. I wanted to know how those patients did afterwards. And so I started looking for a new job in pediatrics. It still just set my heart on fire. I just wanted to know how those kids did after their surgery. And that was the unfortunate part, is like, they were in your operating room and they were gone and you never saw them again. So it was hard. But yeah, so I applied to PICU, and the rest is history. I'm still there now.
So moving on to PICU, well, while we're here, could you tell us more about that and like experience in the PICU, and especially the stress and workload of working in an intensive care unit for pediatrics, and how do you deal with a loss of a child? And it's not always going to be happy, and we understand that, but how do you mentally cope with that?
Yeah, you are absolutely right. It's one thing, I think, to lose a patient, but in particular when it is a pediatric patient, I think that the hurt is much more monumental. I get a little teared up. But I think overall it's the mindset of that, are we doing something to our patient, or are we doing something for them? And that does require us we do invasive procedures. We put in chest tubes, we put in like central lines, we do open chest procedures like at the bedside and stuff like that. But it's all with the intention to hopefully make sure that kid graduates from our unit and gets to live a full life. So that's really just the driving force behind it all, I think. And it's just, for me, a goal should scare you a little and excite you a lot. And the idea of taking care of children and giving them a brighter tomorrow, it makes all the world of difference. But in terms of, resiliency, we do have committees. We have chaplaincy. So, I remember when I lost my first patient, like 6 months after I got up to the unit. I was somebody who wasn't super religious at the time, but just having like a chaplain there who can speak to anybody regardless of their religious background, and just connect on a human level, that was very helpful to me. And our HR actually has, mental wellness, like checkups, or they have services that you could reach out and be like, hey, I'm struggling a little bit with this, or, but I think that our unit, we recognize the work that we do is very difficult. So we are very big into promoting resiliency with our teammates and our charge nurses. When I did lose my first patient, I luckily was off for a set of days afterwards, but everybody reached out and sent me a message, like, hey, are you okay? Like, do you want to talk about anything? And allowed me the time and the space to, put that experience into its place and just accept it for what it was. But yeah, I'm sorry. As far as working there now, In transitioning, knowing that I wanted to go there, I set myself up for success. I went and got my PAL certification right away because I knew that I would need it up there, and just made that marketable on my job application, and just highlighted my personal assets from the OR, that as they translated to the PICU. So I was like, I know how to do procedures. I know about sedation. I can, I'm okay at inserting IVs. And just kind of tried to, market myself that way. And also because I was an in-house transfer, it's like I already knew the university hospital setting. So it wasn't this like weird bumpy road where they were trying to train me to be a critical thinker in terms of PICU, along with trying to figure out like, oh, where's the unit? Where are all these supplies? Like I already knew where all that stuff was. I work a 36-hour week plus. We do have optional call that you can sign up for additionally. It is not required, which was a big mover for me moving from the OR because I had scheduled call. And then critical staffing, of course, every unit's big problem is that we're understaffed or we don't have, enough nurses. So we do offer critical staffing for every six week schedule period that we can sign up for. It intermittently gets approved just depending on our acuity and our staffing numbers. So that's kind of what it's like now. And I think I have another side that will tell like more about like what is a day in the life. So.
Mm-hmm. So moving down this, can we talk about the PAL certification and networking? And could you explain more about that and your specialty versus like how you switch specialties and if it's hard or easy, what the process is, all that?
I think emotionally it's hard because you feel like you're quitting or like running away from something. And also I think the fear of something new is very real. Not knowing, it's like, what is this experience really going to entail? Am I ready? Am I good enough? I think all those questions are very valid when you're thinking about transferring to a different unit. But again, you just got to go with, what's my 5-year plan? Where do I want to see myself? Am I happy where I really am? Or like what's causing like this discord that I feel like I need to leave? So I think identifying and sitting with your feelings and really understanding, your desire and drive to get out of Dodge or wherever you are, that's very important to think about. But as far as networking, I actually, because I worked with a bunch of surgeons who also, had their roles in the PICU, I also had a CRNA who his wife worked in the PICU, and I was like, you know what? I was like, can I talk to your wife, please? Like, and so that's just the social networking aspect. Knowing things about other people can really help you. And it really is about who you know sometimes. And so I was able to talk to her before, and she actually became my preceptor. And I had a great experience with her, and we're still very, very close. I also had a neighbor who had worked in the PICU that I work in now a little while ago. So I was able to really pick her brain and be like, hey, this is where I'm at. This is where I want to be. Can you help me? And so that's that mentorship aspect. Look for people who, are where you want to be, and try to reach out to them, try to network.
Mm-hmm. Wow. So moving on to just more about your day in the life and just how you are, where you are. Like, could you explain a little bit more about that?
Yeah. So these next 2 slides kind of go over what it was like transitioning. Because I was a Clin 2 with 1 year experience already, that's what qualifies at my university for a clinician 2. Our Clin 1s are people who are just hired. They have a year nurse residency where they go to a monthly class, and then at the end of the year, they're a Clin 2 and they get a pay raise. So I had an 8-week orientation. It was very, very brief compared to what a normal 6-month Clin 1 orientation was. So I had a lot of learning to do. We really just sat down, identified my strengths and weaknesses, got me in front, figured out what I was really uncomfortable with or was very anxious about, and then tried to put me in a position to get rid of that anxiety.
Mm-hmm.
I personally purchased my CCRN guide at that point because CCRN, it ties everything into a neat little bow. I think that it just is to the point, and it teaches you a little bit more directly about like the body systems, how they work together, common diagnoses that we see, and treatment plans, as well as, lab values and things like that. It just was very, very put together and helped me, go home. And if I had a patient that I barely got to like look up, what is like HLHS? I was like, I don't know a lot about this. I'm just here to take care of this patient and learn my skills, my like hands-on skills and the flow of the day. So I would just go home and then, sit down and read over things about them so that, it just starts to build your knowledge base. And then I signed up for extra classes, which were offered through my university. They were more onboarding things. But CBLs, it's just the same thing, continuing education credits, to go towards my nursing license, and also just give me a little bit more cushion, and knowledge base when I was going to eventually take my CCRN.
Mm-hmm.
After 6 months, I was TCB trained. And what that means is that I took 3 specialty classes for ECMO open chest, and then an actual course on common cardiac defects that we see and that we operate on. So that was a 3-part course. I would get ECMO patients afterwards. I would get open chest patients. And then once I had taken 3 post-op heart cases, my last one was more of a solo. I did have a backup nurse, but that was my solo case. Now I've been taking care of them for a little over a year. So it just set me up to be able to recover children that have had their heart operated on, and just be very, very assessment focused, and think about, if we need to intervene in their care. So that is honestly my favorite part about what I do is heart surgery. But again, the CCRN certification, once I hit my 1.5 year mark and I had enough hours of practice, I just scheduled my test. I had 90 days to take it when you schedule. I studied and found a date that worked for me that I wasn't working, and I took it and passed on the first time. So it just solidified that I knew what I was doing and knew where my mental framework was when I was working with these patients, and just gave me like confidence in my practice, but also it speaks volumes to the fact that like it is a hard test. And that you are, willing to be certified and be like, I have a dedication to this profession.
Mm-hmm.
And so a day in the life starts off. So there's, depending on day shift or night shift, which I do work both. I primarily work more nights, one, because it pays more, and I get to park in the garage. But it's also very focused at night. It's a little bit more laid back, and our mentality is very, very focused on, sleep hygiene, but also just, keeping them cool, calm, and collected until day shift. So my day starts off at 4 o'clock in the morning or 4 o'clock in the afternoon. I am up. I fit my self-care in by working out automatically for maybe like an hour, hour and a half. And then I head on to packing my stuff up, showering, and just heading out the door by 6 o'clock a.m. or p.m. To get to my job. And then by 6:45, I give myself 15 minutes to get there on the unit, maybe check out my patient assignment, look them up if I feel like I need to, which, now that I've had a little bit of mileage where I am, I don't typically look my patients up before. I just go and get report from my nurse after we do grand board report. We actually go over our entire patient admission on the unit. So who all's there and who all's to come or go. So that all of our nurses on the unit know a little bit about each patient in case they were pulled into a room for an emergency. And then we break off into individual report in which you have 1 to 2 patients typically. There are the nightmare moments where you might have 3, and hopefully that doesn't last for an entire shift, but we make it work. And then just highlighting days versus nights. Daytime, I'm definitely more tired on days. Our daytime nurses do a lot. It's a lot of procedures at the bedside. You're doing patient and family education, you're addressing fears and concerns. It's a lot of talking. You transport a lot to like CT, MRI, OR. So it's a lot of logistical stuff. And then the same thing, just care plan establishment. This is where grand rounds happens again. So our physicians and our care team are talking about this individual patient that you have and what their day is going to look like and what our plan is for them. So it's a lot of discussion on how best we can serve them. Nighttime sleep hygiene. We worry about kids getting delirium, and what that is just like a kind of like a psychosis almost, where they're not responsive. They have like kind of just succumbed to the stimulation of being in an ICU, the beeps, the lights, being touched and assessed and turned at like weird hours and just being off their schedule. So that can really delay a patient's healing time. As well as just like their mental well-being and stuff. So especially at their developmental level. So, we are very big on sleep hygiene and making sure that these kids stay on a good sleep schedule, day, nights. And we do focused assessments. But what is guaranteed is like throughout the 12 and a half hour shift, we do a standard 4-hour full assessments unless anything changes, or if it's ordered, like a neuro patient, I do like a Q1 hour check in on them to make sure that nothing neurologically has changed. We are very strict on intake and outtake measurements, just because if a kid is fluid overloaded as an infant, it can be very bad for them. Same thing, if they're dry, also not good. We want to keep them nice and in the box. Medication administration, and then just charting and documenting. Like those are just the really big things that we're doing. But it's not all encompassing, because you always have like the bedside procedure, the dressing change, you're changing out drips. You got to give report to so-and-so, you got to get report, you got to admit somebody and discharge. It's a lot of moving pieces. But again, getting up there and getting trained and just learning the flow of our unit, I felt very prepared to do those things. And not every day is perfect, but we roll with it and we're a team. And, I think that's what makes the job so enjoyable, is that I know people have my back.
Like, speaking of team, how do you feel as a nurse? How are your relationship with doctors and CNAs and all the other non-nurse staff? Like, how do you feel your relationships are with them?
I am very close, and I think that's also just where I came from in the operating room. It's like you just can't do this job by yourself. You can't do everything. And if you do try to do everything, you are going to run yourself into the ground. So we have patient care techs on our unit and patient care assistants. So it's a little bit of subset between that and like CNAs. But, I'm very close with them. And I think it's important to just respect people at whatever level they are, whether they're a respiratory therapist, they're a PCA, they're my ECMO specialist, or my resident who's learning, my fellow who, is still learning, but very experienced. And then my attending, it's like just having the utmost like respect for your team and recognizing, their personalities is very important, because obviously it's like, you're not going to get along with everybody. But that's not the point. The point is your patient and their safety, and making sure that they have optimal care and a good experience. So, when you reframe that, even if you do disagree with other people, you reframe it in the terms of our patient is our true north, and that's what we're here to do. And so that's not to say that I'm not friends. I am friends with a lot of my coworkers, even outside of work, my attendings, even surgeons that I used to work with. So again, that's just, it's my lived experience, my desire to be social with other people. And I just think I cannot do this job without them. So just asking for help, asking for clarification or guidance from people who are older than you, it's very, very important.
That's awesome. Like building those relationships, it's really important.
Yeah.
So, in your whole experience, your career experience, has there been any special cases that moved you? And if you have had a case, are you allowed to kind of walk us through a case? Like, how did you see the symptoms? How did you address them? How did you decide your course of action? Like, how do you go about that?
So just it's kind of difficult to talk about like particular patients just because of like HIPAA stuff. I like try not to get into that because it can get pretty, I think in intensive care, because you have to be so detail oriented, the small changes that are subtle that mean like big catastrophic things down the line for our patients. I can speak to, my favorite thing is the treatment of hypoplastic left heart syndrome. So that's where your left ventricle is atrophied and very tiny, and therefore you don't have very good systemic blood flow. It's a very difficult heart condition to treat, but we can treat it. So in surgical management, I think one thing that I can really think of is being trained to open chest. So the first palliation of HLHS patient is doing like a Norwood Sano typically, and that is just a shunt that allows systemic circulation to happen because those patients they're literally living off of the PDA, the patent ductus arteriosus, that's there when you're an infant or a neonate in utero. So they're literally living off of that. They require what's called prostaglandins to keep that open until we can operate on them. So, that comes with its own management, and it's very, very critical. But when we get them back from that first case, their chest is typically open because that shunt is very small. And I cannot speak more to having very critical and well-developed assessment skills, because for like a particular patient that I'm thinking about, it's that their murmur, which is, it's in a normal, listening to a normal heart, it's just that lub dub. A murmur is something, it means that blood is being shunted somewhere. And you want to hear that, especially in this kind of patient with their Norwood Sano. Listening to that, their murmur just changed a little bit. It just sounded just a little bit different. Nothing else had changed. Their vital signs were still normal. But again, I was like, I just picked up on it because they get very focused hourly assessments that first night. And I was like, it just sounds different. And I let my attending know, and I'm not kidding you, probably within the hour, we were taking their patch off, and we had our surgeon in there trying to fix their shunt. So because they had decompensated, because it had clotted a little. So it's just, yeah.
That's so cool that you were able to like pass that on to the doctor. And
yeah. And so, and that's the relationship I had. I was like, might not be important, but it's different. And I think our team is just very responsive to that. They value everybody's input, and they like, even if it's a small thing, they're like, okay, they come in and look. And it's because, we really are focused on our children, and just making sure that they make it through these critical periods. So, it's just have your assessment skills down pat, and don't be afraid to just say, hey, something's different. It might not mean that like anything has changed vital signs wise, but it can, and down the road, like if you don't intervene or just speak up and say something about it, it can go south very quickly.
so just wrapping it all up. So why pediatrics, and how did, I actually saw a question on here that kind of relates to this. How did you get a job as a new grad as a nurse, like getting a specialty of your choice, and then why pediatrics?
Right. So why pediatrics? This is written by me. It's just to take care of a parent's most prized possession, their child, and give them the opportunity for a brighter tomorrow. It's changed the way I am as a person. It gives me great joy, it gives me great purpose. And so that's why pediatrics. Kids are so resilient. They could literally there's like an Instagram account, I think, on like what things kids say. And it's like they could have these invasive lines on them, or they can be intubated and they can still be sitting up and playing and at their developmental level. They're just so resilient. They're so optimistic. And, I work with child life specialists who, they help me care for children at their developmental level and speak to them in ways that they understand and that they can process, because sometimes that's hard because I'm literally focused on keeping them alive and assessing, and that gets a little methodical. But my child life specialists, they just, they help me get on my child's level and my patient's level, and really just try to bring them out of their shell, because it's a very scary experience sometimes for them. They're not in their comfort zone. So it's important for us to meet them at their developmental level. And I just love them. I don't know. They're the best. I just couldn't imagine working like anywhere else.
So we're gonna open up for some current work life questions. So let's find some.
Yeah, I'm sorry this is running over. I don't mind staying if you guys mind staying. So I'm sorry, it definitely took up a lot of time talking.
No. So one question is, do you have any tips on standing out when applying to colleges, considering people typically have similar applications? So like what helps you to stand out and be better than the next applicant?
So it's like, it's really, it's what you have, it's what you bring to the table. And while there are like very similar people or that are trying to apply to the same program, just finding that you factor is so important. It's the market-sized hole in in the gap that you fill. So, just really speaking and being true to yourself, and your experiences, I think, is what sets people apart. And a lot of colleges, or at least it was mine when I applied, I had to also go in for an in-person interview when I was there. So just being able to speak, and be true to yourself about what your intentions and your aspirations are. For me, I also on summertime worked with like functional life skills in a school system as a teacher's assistant with my brother-in-law. So that was something that I spoke to in my application. I was like, I work with these children and I just think it's so wonderful. And I just want more for myself. I want more of this and this. I was like, I can just see myself moving in this direction. And your program, speaking in terms of like what their goals are, their mission statement, speaking in terms of a university's mission statement is paramount. Like for my institution is Aspire goals. So it's just like respect, stewardship, excellence, things like that. So incorporating those little tidbits into like your personal mission statement, I think it's important. It's just framing them and being like, I'm a good fit for your university because I already have your values.
Right. So, have you ever considered going on to be an NP, and how does the role of an NPs change day to day as compared to nursing?
So yes, I have thought about going to NP school, and to be a nurse practitioner. And this is what I know, just speaking in terms of pediatric nurse practitioners. The degree path, it is a Master's of Science in Nursing with the potential to excel to a doctorate of nurse practitioner, which is your PhD prepared, more like research based. But there are also two clinical paths. You can do primary care, which is a clinic based. You'd be like outside of the hospital. That's like your wellness checkups and things like that, and monitoring patients when they go home. And making sure that they're hitting their developmental like milestones and their vaccine schedules and things like that. And then you can do acute care. So those are your nurse practitioners that are working in PICUs. They are working in focused clinics. Probably like some of ours are acute care NPs working in our cardiology department. And they're following those patients, but you're trained, and hopefully already like experienced like as a PICU nurse. So you've seen a lot of these patient populations and the diagnoses and treatment pathways, but then you're becoming more focused. You're learning, embryology and starting really from the beginning in a very focused manner. And that is teaching you a framework of thinking that aligns with what your doctors are doing, how they're going about trying to treat their patients, and figure out what is the right pathway for them. Our nurse practitioners can prescribe medications, and that's just state dependent, I think, as well. Same thing with opening your own practice. I'm not too sure on that. I haven't looked into that at all. But if you did not want to be a nurse practitioner, you could also go into a master's of nursing in clinical leadership. You could do management. There's several options. You can even do an education. So if you want to be in academia, you can go and get a master's of nursing education and come back and maybe be like a clinical instructor or something like that. But also it's like, if school is like just not something for you, you've got your nursing degree, you're like, oh, ever want to go back to school, I don't ever want to take an NCLEX test again. That's also fine. There are ways for you to progress your career without going back to school. And I think that's really, really important to highlight on, because we still need those higher clinicians with experience on our units that are, progressing protocols and doing quality improvement measures. And that comes with mileage and just having that experience on your units, and just knowing what you're talking about and the types of patients that you're taking care of. So you can climb the clinical ladder that way. We have a tier system. So there's Clin 1s, 2s, 3s, and 4s. 4s are literally, they're the highest. It's also the highest pay grade. And if you have specialty certifications, you can market yourself to get paid even more there. But it also comes with a little bit more responsibility. You are doing quality improvement, like research and intervention measures to make your unit better and more functional, and let that workflow improve.
So when dealing with all of this, with all your just your day-to-day life, how do you have a work-life balance, and what do you do when you're burnt out? Like, how do you handle that?
Well, sometimes I cry, but work-life balance. As far as working like in the PICU, I know my requirement is 36 hours a week. It took me a long time to figure out what schedule worked best for me. I've tried like 3 in a row. I've tried, 4 in a row. I've done, 1 shift, a day off, 2 shifts, and then off for a little bit. And, it just takes some time, I think, to figure that out and what's right for you, because what's right for somebody else doesn't mean it's right for you. So just trying to figure out what scheduling works best. That is very important. Working nights and days and flip-flopping and rotating, it does get a little bit hard. So I think just finding out, right now I cannot apply to be like an only day shift person, but also part of me is like, I don't also envy doing that, because it's like, while you do get to be on a normal schedule, you're working really hard shifts. You do a lot on day shift. And there is also the pull of a night shift differential when it comes to pay. So not only do I get paid more when I work nights, but also that's my patients and my parents are asleep. I'm not doing too much education unless I need to. We're doing like minimal things unless we do need to intervene in a patient if they're decompensating. It's like more tight knit, and then but again, you're flipping your circadian rhythm, you're off and you're awake when everybody else is asleep. And so when I come home, I obviously sleep. Today, I actually slept until 3:00 when I got home. And, I haven't seen Mike, my husband. So it just takes a little bit of figuring out. But I also, I talk with people at work. I have friends and my family that I relay things off of. And it's like, hey, I'm noticing I'm grouchy all the time or whatever. And just pinpointing, what is that? What is really bothering me? is there something that I can do to fix it? And sometimes it also takes talking to management and just being like, I am unwell. I'm just not doing the best I can do. And they can come up with, ways to help you if you have like a really good manager like I do. So I fill my emotional tank outside of work by working with healthy children, coaching field hockey. I finally got back to my roots. I really missed playing and coaching field hockey. So working with that high school team, I love coaching and mentoring them. They fill my emotional tank so well. And then I also focusing on my health, my body's health is very, very important to me, and is something that has, made me a better nurse in general, and just a happier human being. So I do compete in, bodybuilding competitions. It's just something that I've channeled my energy towards, and it also just gives me a schedule, kind of like what I had in college, where I was like, I'm at practice now, and then I'm at work, and I'm studying. It just perpetuates that schedule that I had, and it makes me very happy.
So just to wrap everything up, do you have any word of advice for anyone, just like a final statement?
Trust the timing of your life. I know that I'm saying, think about your 5-year plan and where you want to be, but also don't get caught up in that. Like, that can be overwhelming. Then it's like, I'm not where I'm supposed to be and stuff. And I just wanted to express that to people. You are where you're supposed to be. And if you can just think about building that wall just each day, I'm going to lay this brick as perfectly as it can be laid. I'm going to set myself up for success tomorrow, and just continue building on that. You're going to get exactly where you want to be. And if you work hard and just focus on the things that are important to you in your life, there is always going to be a need for healthcare workers. So, get in there.
Mm-hmm.
It's crazy. There's so many outlets for people to be in healthcare in any capacity. So if you guys have any other questions, like, I don't mind hanging out or anything. My only other, word of advice, if you guys need help with like resumes and stuff, I am an affiliate for the Resume RX, which is a lady named Amanda, and she's a Yale prepared nurse. But she focuses on, and I've used several of her resume templates and stuff, and she actually does like courses. I do have an affiliate link that will get you 20% off, which can be super helpful as you guys are applying. It comes with 6 download templates, so you can like repurpose them over and over. So treat yourself. If you guys need help with resumes, she is the bomb for medical resumes. I also offer free download for top 10 pediatric nursing jobs. And so if you're like, PICU is too intense, I went around and created a guide that helps nurses figure out, like, how can I work in pediatrics, but maybe not do critical care. So this touches on like clinical and outpatient settings, as well as, within the hospital.
Mm-hmm. Well, thank you so much for speaking with us. We really appreciate it. And I know you guys have been asking a lot about how to put this on resumes, applications, stuff like that. So I would suggest that you write it down as a virtual experience/opportunity to discuss medical related topics with a health professional, which would be our RN. When writing this down for apps or discussing this in essays or writing it on resumes, make sure to indicate that the meeting wasn't hands-on, but if it helped provide an overview of the health profession, if it motivated you, or if it taught you if this path was or was not for you, make sure that you include that, because it's always good to relate it to you personally, because that's what they look for. And this is overall just a good resource for why this profession essays, because when you're applying for nursing school, they might ask why, and you could explain it. And if you were trying to be an MD or a DO, you could also explain why not nursing based off of these conversations. And remember, the whole point of this is to show that you guys are still trying to learn and get experience, even with all the restrictions because of COVID-19. So if you guys can just show that you were still actively participating and learning, that would go a long way for you guys. So that's just to wrap it up. Make sure to tune in next week. Next week, we actually have two speakers. We have a pharmacist who is a oncology fellow, and we also have a dental student from USC School of Dentistry. So make sure you tune in for that. And of course, if you have any questions for Katie, she does have her email, Instagram, and TikTok. So if you want to screenshot that or take a picture of that, you can reach out to her personally. Well, thank you everyone for coming, and I really appreciate it, Katie, for speaking with us. And
Absolutely. It was my pleasure. And seriously, if you guys do have any other questions that I didn't get to, I know that there were a couple in the chat, and I'm so sorry. Please reach out to me. You can reach out to me on social media or by my email. And again, in the chat, I don't know if it's sent to everybody, but feel free to click on that URL, and that gets you the download. And it also shows like my Instagram, my email, and things like that. So it was really lovely talking to you all, and I hope that opened your eyes to just the potential that you guys have to be a part of the healthcare system and maybe even be a pediatric nurse.